Those are room temperature, and this is room temperature, but we aren't. We are all about 22 degrees above room temperature. That's not random. Let's think about how contrary that is to the law of entropy. One person isn't 10 degrees above room temperature, and another 20, and another 30. Whether we are newborn, middle-aged, or elderly, male or female, tall or short, black, white, or green, our bodies all work to maintain our temperatures within the same very narrow range. If it's cold, we shiver to stay warm. If it's hot, we sweat to stay cool. That's no accident. There's a very important reason for this. Almost all the chemical reactions in the body are catalyzed by enzymes, and enzymes depend on their shape or conformation for their activity, and their shapes depend on their temperature. If they're too hot, they're too loose, and if they're too cold, they're too tight. But if they're just the right temperature, then they're just the right shape and can function optimally. Of course, temperature matters. We know that, but we tend to overlook it. Everyone knows that when people fall into Lake Erie and their body temperatures drop towards 90 degrees, hypothermia is setting in, and it's a medical emergency. And we all know that when people get overheated and start developing heat stroke, that's also a medical emergency. And when people are sick enough for their body temperatures to be over 100, just 1.5 degrees above normal, they're readily excused from work. Why then, when people are suffering from temperatures that are 1.5 degrees or more below normal, are they dismissed as being fine? It's obvious that there's a continuum of temperature-mediated problems, and that moderately low temperatures have been largely ignored historically. How low is low? 97.8 degrees or lower measured orally is classic, and is more than enough reason to explain debilitating symptoms. And sometimes patients' temperatures can be quite low, like 96 or 95 or 94 or even lower. On the other hand, people with mildly low temperatures, such as 98.2 or even 98.4, improve clinically when their temperatures are normalized to 98.6. People being treated with T3 for low temperatures can sometimes notice a difference in a matter of hours, usually within a few days, and almost certainly within a few weeks. But probably the most exciting thing about correcting low temperatures is that the temperatures and symptoms can often remain improved even after the treatment has been discontinued. Normalizing low body temperatures is one of the most dramatically effective treatment modalities there is, because the body temperature is one of the most fundamental physiologic parameters there is. When you address the body temperatures when other doctors don't, you can often dramatically help people when other doctors can't. The need is so great and the results are so good that many doctors end up treating low temperatures as the bulk of their practice. We use the term Wilson's temperature syndrome or Wilson syndrome to describe the low temperature conservation mode physiologic state that I was mentioning earlier. WTS is characterized by people with low thyroid symptoms and normal thyroid blood tests that respond well to normalization of low body temperatures, usually through the use of T3 and/or herbs. You see, the symptoms of hypothyroidism are the symptoms of low temperature. People become symptomatic with hypothyroidism only when their body temperatures drop below normal. And the symptoms of hypothyroidism don't improve with thyroid replacement until the body temperatures improve. The thyroid system is responsible for maintaining a normal metabolic rate, or in other words, maintaining normal body temperatures. Typical symptoms include fatigue, depression, easy weight gain, and fluid retention. But low body temperatures can also cause symptoms not often associated with low thyroid function, such as migraines, PMS, anxiety, panic attacks, and asthma. When low body temperatures are normalized, these symptoms often improve or resolve completely. Of course, hypothyroidism results in low body temperatures due to inadequate production of thyroid hormone by the thyroid gland. However, people can still suffer with debilitating low temperature symptoms even though the thyroid blood tests are normal. How can that be? Let me ask you a trick question. Where is thyroid hormone produced in the body? Most reasonable doctors would say in the thyroid gland. However, it could be argued that the best answer is in the peripheral tissues of the body. The explanation is that T3 is the most active form of thyroid hormone, and 80% of it is produced outside the thyroid gland, in the peripheral tissues of the body. So just because T4 is being produced in the thyroid gland doesn't mean it is being adequately converted to T3 and utilized in the tissues of the body. It is apparent that peripheral conversion of T4 to T3 is subject to some regulatory mechanism. When people are under extreme physical or emotional stress, their conversion of T4 to T3 can drop by 50% in a matter of hours. Fasting, illness, and cortisol can also inhibit T4 to T3 conversion. Unfortunately, it appears that the system can become imbalanced because the depressed metabolic state can persist long after the stress has passed. The typical story is a lady going along fine in her life because about 80% of WTS patients are women. She goes through some major stress like childbirth, divorce, death of a loved one, surgery, or some accident. Her temperature drops, she develops the symptoms of low body temperature, and is never the same. Childbirth is the #1 cause. So what can we do if a person is suffering from persistent low body temperatures and it appears that the thyroid system has gotten imbalanced, even though the thyroid blood tests are normal? We could do the same thing that is often done in the female hormone system when it gets imbalanced, even though the blood tests are normal. Just as oral contraceptives are often used temporarily to reestablish normal menstrual cycles, in a woman with irregular bleeding, T3 can often be used temporarily to reestablish normal body temperature patterns, with the symptoms and temperatures often remaining improved even after the T3 has been discontinued. The treatment of WTS is not new. It's been presented at medical conferences for over 15 years by myself and other people. There is a constituency of like-minded practitioners that have been treating WTS every day for years. Many are on a referral list. Call them and ask them how it's working for them. Ask to talk to their patients. Hear it in their own voices. WTS is essentially invisible to mainstream medicine. Most doctors don't recognize this condition because they're not looking for it, and they don't know how to treat it. Nothing will convince you of the reality of this condition like seeing the first of your own patients recover.